classes in this film, so I'm just going to go over this since we are doing this assignment remotely today. We are discussing Chapter 8, Cardiovascular System Procedures. First procedure we're going to talk about is coronary artery bypass graft, which is, some people would just refer to it as CABG. It's a surgical treatment for the coronary artery disease, grafted vessel anastomosed around a blocked segment of a coronary artery. So you can see that pink says bypass graft. That artery is probably taken from somewhere like the leg and moved up here and makes a nice open vessel for blood to move because that other coronary artery is clogged. That's when they do the open heart surgery, that's what they do. Percutaneous transluminal coronary angioplasty, or PTCA. This is where they put the balloon in. So a balloon catheter inserted through a small incision and placed at the site of the plaque. The balloon is inflated, pressing fatty plaque against the vessel wall. The balloon is deflated and removed, leaving the stent in place. So you can see right there that blue and line A is the balloon. They've opened up that balloon, and you see how that yellow, they've flattened the plaque to kind of open up that artery, and then they pull the balloon out, and it leaves the stent. The little chicken wire looking thing is the stent, and that keeps that vessel open and not being so blood can move through there. And those, when you talk about people that have had a stent after a surgery or chest pain, that's what they're doing there. And stents can stay in place. I think they stay in place about 10 years, and then sometimes they'll start to get reclogged, and they may have to replace them. Coronary artery ultrasound is a painless screening test that uses an ultrasound probe passed over the carotid arteries to produce images of the carotid artery. So they're just using a little Doppler thing to check the blood flow of the carotid artery right there. It's used to identify blockage in the carotid artery that places one at risk for a stroke. So sometimes they can check the carotid artery, and if that's clogged, then you're more high risk for plaque dislodging and causing a stroke in the brain. So if they happen to find that your coronary artery is blocked, this is the procedure that they do. It's called an endarterectomy. It's a procedure to remove atheromatous plaque from the inner liner of the carotid artery. So you can see in that first picture, they're just making an incision right there of the carotid artery. They take out the plaque and suture the carotid artery back together. So in that case, they're just opening it up, removing the plaque, and closing it back. Electrocardiography, ECG or EKG. I've always called it EKG, but I always wondered why, because there's no K in electrocardiography, but they are the same thing, ECG or EKG. Painless, non-invasive test that records electrical impulses of the heart using electrodes placed strategically on the body. The impulse is displayed as a line tracing on a paper strip with spikes and dips called waves. The wave interruption identifies various cardiac irregularities. So a lot of people before surgery and stuff, they'll have them. That's part of their pre-op is to have an EKG. And then another option is the EKG is just you put the leads on, like it's in this picture, and then you take a picture and then you take them off. Now, a Holter monitor is still an EKG, but it's going to stay on for 24 to 48 hours and record all of your heart rhythms for that time frame. So sometimes if they're wondering if you've got some kind of heart condition going on, they'll have you wear a Holter monitor for 48 hours. Usually they have a little button on them. If you're feeling anything at that time, you press the button and say, okay, I'm feeling a little lightheaded right now, and they'll look and see if anything is going on with your heart at that time. It identifies irregularities that would be missed with a regular EKG of only a few minutes in duration. So we also have an ECG or EKG stress test. So a lot of times you go to the doctor, you'll say, I've been having some chest pain, and she will probably say, okay, let's do a stress test. And so this is having them walk on a treadmill or something like that while they're being monitored and see how your heart does under stressful conditions. So they'll have you, elevate that like you're walking up a steep hill and things like that, and see how your heart handles it. If you failed the stress test, then they're probably going to have you do a cardiac cath to check your coronary arteries to see if there's any blockage. If there's blockage, then they put in the stent, all that. If there's a lot of blockage, then they do open heart. So your goal is when you have a stress test to pass it, because if you fail it, you're going to have further tests. For those people who are older and aren't able to walk on a treadmill, they have medications that act like you're making your heart work harder, and see how it's exercise-induced stress called the treadmill test. So not everybody can tolerate the treadmill, so they'll give them medications that simulate simulates making your heart work harder like you were walking on a treadmill. Okay, so inflatable cardioverter defibrillator. This is an ICD, a device that's implanted in patients at risk for developing arrhythmias, which are irregular heartbeats. It monitors the heart rate and corrects tachycardia or bradycardia. Tachy is a fast heart rate. Bradycardia is a slow heart rate. Delivers a jolt of electricity to restart the heart if it stops. So some people are known to have a heart problem and they're likely to go into defib. So if they do, it'll just shock them like they're using the AED. And it's called an implanted defibrillator, or implantable cardioverter defibrillator, ICD. So cardiac catheterization, I mentioned that earlier. This is when you fail your stress test and they're going to say, okay, let's do a cardiac cath. The catheter is guided into the heart via vein or artery for diagnostic purposes. A lot of times they do go in the femoral artery up there, and you see the arrows, they've gone up there, and they're going up through the aorta, and then to look at the coronary arteries on the heart. And if they find one that is clogged, they do the balloon stent, or the PCTA. If it's really like 100% clogged, that's when they decide that they can't just put a stent in. They can put a stent in during a cardiac cath, but if they need the coronary artery balloon graft, then that requires the open heart surgery. That's when they'll cut open the chest and put that, take that artery from the femoral and put it up in the heart. Okay, coronary angiography. This is a X-ray procedure, radiological procedure that visualizes the coronary arteries. Cardiac cath under fluoroscopic guidance administers a contrast medium to facilitate the imaging. So it's kind of like an ultrasound of the heart a little bit. Images identify areas of obstruction and stenosis in coronary arteries. So they're doing the cardiac cath, but it's under X-ray. Okay, when we talk about drugs given or pharmacology for heart conditions, an antiarrhythmic is given to prevent or alleviate or correct cardiac arrhythmia. So somebody with a abnormal heart rhythm is going to be on an antiarrhythmic, which makes sense, right? Beta blockers and calcium channel blockers are both given for high blood pressure. Beta blockers block the effect of adrenaline, which slows nerve impulses through the heart. And calcium channel blockers block the movement of calcium into myocardial or heart cells and arterial walls, and that's how they help lower blood pressure. Diuretics act on the kidneys to increase excretion of the water and sodium. So sometimes, I don't know if any of your grandparents, parents, anybody is on Lasix, but that's one example of a diuretic that makes them, it acts on the kidneys, so it makes them have to go to the bathroom a lot and pee a lot. So, that's one that we tell them when we're giving patient education. This is not something we're going to take before you go to bed because you'll be up all night peeing. So, nitrates dilate the blood vessels of the heart, causing an increase in oxygen to the myocardium. So somebody is known to have angina or chest pain. When they have a little fit of chest pain, they pop a nitro, which means they put a nitroglycerin tab. Those are given under the tongue, and it just absorbs, and that will help dilate those blood vessels because the pain is probably coming from the good oxygen flow of not very open arteries. So that kind of opens up and dilates those blood vessels of the heart to relieve the chest pain. Statins are a medication. If anybody goes to get their cholesterol checked and it's high, they're probably going to put them on a statin drug, and that lowers cholesterol in the blood and reduce production in the liver by blocking the enzymes that produces it. So a lot of older people, 60s or so, they may get started if their cholesterol's up, maybe started on a statin drug. And then a thrombolytic is remember, I think we talked about this, thrombus is a blood clot. So a thrombolytic dissolves the blood clots. So something like that would be Coumadin, heparin, those things help dissolve blood clots. And that is it. And I think that most of your everything on your homework should be in this slideshow. So you can answer those questions while you're listening to me, or you can go through the slideshow again and get those questions answered. All right, that's it. Thanks.